Yes, I think there is a big demand within the immunology space. And I think the reason for that is because that's where the money is going. A lot of private equity and VC firms are investing heavily into the autoimmunology, immunology, and inflammation space. Previously, a lot of focus was in oncology, but I think immunology has become more prominent because when you look at the area, there's so many, let's say, disease under it, where you look at fibrosis, respiratory, vaccines, etc. They all fall under that, and it's so broad, so vast. So there is an increase in need in the area, and that's because of the money.
I have seen a lot of candidates on the market at the moment, because obviously with any financial struggles, quite often companies shift to have a focus on their clinical assets, as obviously that's where they're going to make their money. So I think sadly the preclinical space has taken a hit in that sense, and there are quite a lot more candidates on the market. So it is a little bit more tricky to get roles now, just because obviously there's a lot of candidates who are really good candidates. But immunology as a whole is increasing, and yeah, as I said, most of the roles that I've actually placed recently have actually been in immunology. So
there's definitely a real need for immunologists that are good communicators, because a lot of the projects now are incorporating AI and things like that. So being able to communicate your understanding as a biologist efficiently to someone that's, say, a software engineer or an AI scientist is definitely valuable in the industry at the moment, because I think previously the two skill sets have been very separate, and I think they're merging quite drastically. So if you're an immunologist and you're potentially not even kind of interested in becoming a full-on coder, but you've collaborated very closely with people that know how to code, you've got an understanding of how AI works in the drug discovery process, I think that makes you a really, really valuable candidate in the market at the moment, because I think a lot of companies are moving towards that direction.
Obviously the clinical roles then require sort of patient interaction or the understanding of clinical trials. So my advice would be to go through sort of courses online, or try and get some internships during your time in academia, just to show that you have a solid understanding of clinical protocol. But obviously sometimes as well, roles, if they are the more junior roles, they will accept that you are coming from academia, and as long as you've sort of had some experience working alongside the clinic and have an understanding of it, I think that's fine, as long as you're sort of showing initiative and sort of a desire to learn more about the clinical space. I think, yeah, definitely for the more junior roles, that would be fine.
So I guess all biotechs at one point or another, I mean, no one can run away from AI at this stage, right? It's just a question of whether, do they have enough money to hire such a person in-house, or are they outsourcing this to a CRO? I think you can never go wrong with having more informatics experience somehow, one way or another. But then it really is also about, some people really, really believe in AI and are fully into AI, and some are a little bit more traditional. So in a way, of course, it's no question, this is where we're headed. There's going to be, you can only benefit from going in this direction. Whether or not this is necessarily something that will make the biggest difference in your career, I don't know. I couldn't really say.
So I think that departments are often different, but I really see them sort of interlinking and working very closely together in sort of cross-functional teams. I think obviously with the drug discovery and personalized medicines that are coming out in the future, they use a combination of the two. So I really do see it merging. I worked recently on a data scientist role, but they really wanted someone who had an understanding of wet lab biology and how it linked to the data science piece. So the candidate who actually got the role had a solid background and had experience working as a wet lab scientist, and then transitioned into the data scientist piece. So that wet lab experience actually helped them in that sense, above sort of just pure data scientists.
I think if you're deeply trained in immunology, you have worked with a variety of tools and products. Those tools and products are made by somebody, are made by biotech companies that could really benefit from your hands-on experience. So if you're looking to transition, then the obvious transition would be to work for a company that you've worked with their products for the last 5 years behind the bench. You then become responsible for supporting it, selling it, marketing it, or further developing in, let's say, R&D. They're looking for newer versions. The best direction, if you want to transition away and you want to move to industry, would be to apply for companies that you have worked with. Now you've worked with their products.